talking about health disparities in the U.S. Healthcare system. The sources I use for today are U.S. News and the OMAN Medical Journal. Imagine you've recently become ill or got in some sort of accident and you need medical attention. But then also imagine you're one of 20 million people who has a limited English proficiency. So English isn't your first language and you don't speak it that well. And that number is only increasing with time. By the year 2050, it's supposed to be up to 60 million people. So the number of people that don't know English or have limited English is only growing with time. And these people are 35 to 42% less likely to get medical attention because of this. Because a lot of them think, why bother going to the hospital or to the doctor since we know already that we're not going to get the proper care we need because of the language barrier. Today, I'll be talking about what language disparity looks like, the effects that it has, and what can be done about it, and is being done about it. The effects that it has are many. For instance, a lot of the times patients are misdiagnosed because the doctor doesn't know what's going on since they can't communicate that. There's delayed treatment because they don't find out about a problem until much later, since again, the language barrier. The overall quality between medical professional and patient reduces significantly. And one that surprised me was the cost, since although insurances should cover medical interpreters, a lot of the times they don't. So these people are paying out of pocket more for these medical interpreters, which is just unfair. What can be done about it? The University of San Francisco did a study in 2011 that saw tools such as Google Translate and Medibabble to improve the quality between patient and doctor by 92%. So even these simple tools can help out hospitals and patients out a lot. Medibabble specifically was created by these medical students to help the patients could communicate more with their doctor. It is a software that has thousands of instructions in different languages and thousands of questions that patients can answer. And what's good about this application is that it can be answered with yes or no questions. So the patient has really simple tools to answer those. What's important to know is that a lot of the times when a family or a person has limited English proficiency, it's put upon the child, or if they have kids, to translate. And that's a lot of responsibility for a kid to translate important medical documents or instructions. So to reduce that, every hospital should use these applications to improve their overall quality. And they should be taught in hospitals and for doctors, and take away that responsibility from the kids. Thanks.